Hello, my name is Kennedy, and today I'll be administering your IM medication of Haldol. Okay, I'm just going to verify the physician's orders. Okay, and can you verify your name and date of birth for me? Okay, and I'm just going to perform a focused assessment on you. So first, in order to perform a focused assessment on this patient, I would attach an ECG to monitor the heart because Haldol can affect the heart, and I also would like to assess the patient for agitation. So, when did you notice this agitation? When did it come about, and what triggered it? Okay, and also how many hours of sleep have you been getting? And okay, and how has the quality of your sleep been? Okay, thank you. And I would just compare Haldol with other medications to make sure that these medications don't interact to cause the patient dysrhythmias or arrhythmias. Okay, and I'm just going to perform hand hygiene. I have clean gloves here. And I have my medication of Haldol. I'm just going to check the expiration date, and I'm just going to check the MAR with the physician's orders again. I have my syringes here. For IM injections, you would use a 22 to 25 gauge syringe with a 1 inch to 1.5 inch needle. And so I am going to just pop the cap off and clean the vial. So the order was to give 4 milligrams of Haldol. However, on hand is 1 milliliter per 5 milligrams. Therefore, I will be injecting 0.8 milliliters of Haldol into the patient. So I've opened my syringe. I'm going to remove the cap off of it. Okay. I'm going to draw up 0.8 milliliters of air. And now I'm going to inject that air into the medication. And now I'm be drawing the medication up. Making sure there's no air bubbles. I'm just going to remove the air bubbles. Okay. And I'm just going to use the swoop method to recap the needle so that way I can change the needles out. Okay. And now I'm going to remove, oops, I need to do the swoop method again to recap it because the needle did not come off when I tried to remove it. Okay. Now I've removed the needle. I'm going to change into the needle that I'll be delivering the medication with. Making sure not to touch the plunger against anything to prevent contamination. Okay. I have my needle here. I'm going to take it into the patient's room with me. However, I would label the medication first because I am outside of the patient's room preparing it. And now that I'm at the patient's bedside, I'm just going to verify the medication administration along with the physician's orders again. Okay. And so, ma'am, I will be administering this medication in your deltoid muscle. You could have it delivered in the deltoid, in the vastus lateralis, or the ventral gluteal. Okay. And I'm just going to take an alcohol swab. I'm going to cleanse the site, dispose of this, let the site dry. And now I'm going to give the medication. I'm going to give the medication at a 90-degree angle. I'm going to use the Z-track method, so like that. And I'll be giving the medication at a 90-degree angle. Before giving it, I'm going to aspirate, so move the plunger up. And now I'm going to inject the medication. I'm going to inject it slowly, 1 milliliter per 10 seconds. Okay, Okay, once the medication has been injected, I'm going to leave the plunger in for a little while. Then I'm going to take it out and add a cotton swab and dispose of this in the sharps bin. I'm going to gently apply pressure with this cotton swab. Okay. After pressure has been applied, I'm going to dispose of this as well in the biohazard bin. I am going to remove my gloves and perform hand hygiene. And I'm going to document this procedure.